Let's start it. Ready? All right. That's pretty fun. I'm Delegate Malcolm Ruff, 41st District in Baltimore City, and we are here for the first Capital Budget Subcommittee meeting of the year in the House of Delegates. On behalf of Vice Chair Chang and the rest of the committee members, we invite you all to this hearing and I appreciate your attendance and participation. And we will start this hearing with the capital fiscal briefing and call on our DLS analyst, Emily Haskell, to give us that briefing now, if you will. Is your mic on?
Again, Emily Haskell, and I'll be, along with Matt, presenting the capital fiscal briefing. I'll jump in on page 1. This chart shows an overview of the capital program, comparing last session and also what was planned last session for this session. You can see the overall size of the capital program decreases to $2.6 billion. A large part of the decrease is due in part to the delay of the expected built-to-learn issuance, which I'll talk a little more about in a bit. The GO bond level meets the Spending Affordability Committee limit of $1.75 billion. There's also an additional about $75 million of GO bond capacity created through deauthorizing prior year projects. And there's also supplementing GO bonds. There's $5 million of bond premiums and $58 million of PAYGO general funds. The general funds generally support the governor's economic development initiatives, including $14.6 million as the first installment of an 8-year, $116.5 million commitment for the expansion of AstraZeneca facilities. Page 2, this chart shows the same information by category instead of fund source. You'll see public safety is less than planned due to the deferral of the Baltimore Therapeutic Treatment Center project, which Matt will discuss more in a minute. There's also more than $250 million for local projects. That includes $75 million set aside for legislative initiatives, and it also includes about $59 million that was pre-authorized by the legislature last session out of the total of $111 million pre-authorized by the legislature. Page 3, this chart shows funding for the capital program over time. The overall size of the capital program has been decreasing in recent years. And that's mostly due to the lower availability of general funds. And I'll turn it over to Matt.
Okay, thank you. Thank you, Emily. On page 4, this is just a little more background on where the state is with respect to its debt affordability ratios. The state has an 8% debt service to revenue ratio that is one of the key factors that is used by the rating agencies and one of the limiting factors that the state puts on itself to control the amount of debt and ultimately the amount of the amount of debt service that's required in the budget for this purpose. So you can see that through 2031, we're still well below projected the 8% ratio. But there's a couple things here. You can see it is increasing. Part of that is because the $1.7 billion level that Emily had talked about earlier, which again is affordable, has only been in place for a couple of years. So as those authorizations begin to get into the actual issuance stream, you're going to begin to see increasing debt service, and of course the ratio is going to go up. But of course it will depend on revenues, state revenues. So these things are adjusted every year, and we report this every year. Beginning on page 5, there's an interesting topic to this. So, you know, in addition to the amount of debt that the state authorizes that they count as part of the state's debt calculation, the state has authorized the Stadium Authority to issue a lot of debt that is both supported with general funds, but a lot of it is supported with lottery revenues, much of which the state does not count towards its state debt affordability calculations. And the exhibit on page 5 gives you a summary of what has been issued recently roughly about 5.7 has been authorized for the Stadium Authority in the last 5 or 6 years, of which about 5.5 billion of that is not counted towards the state's debt affordability calculations. And then one of the reasons we point this out is because obviously this is a place where the capital program has grown outside of sort of the debt affordability constraints, but it is also a factor that the rating agencies use in assessing, where the state is with its affordability ratios. And I point that out because this, in combination with several other factors that Moody's in particular pointed out, the amount of lottery debt, the pension liability, a couple other factors, resulted in Moody's downgrading the state from AAA. So I wanted to point that part out. Another key feature to the budget that Emily had discussed earlier, and a little bit more of a breakdown, is that the budget includes a significant amount of what we'll call operating relief, where funds are being transferred to the general fund, some of which are being replaced with GO bond funds, others not. And so on page 6 and page 7, you begin to see sort of a breakdown of what these components are. I'll just walk through them briefly, and if you've got questions, I can try to give some additional detail and context. But roughly 72 million of transfer tax revenues are being diverted to the general fund and are being fully replaced with GO bond funds. There's also a transfer of 70 million from the Bay Restoration Fund. The plan is to replace 50 million in fiscal 27, and another 20 million is programmed for fiscal 28 to fully replace that. This is not the first time that these funds have been used for for operating relief, and in most instances, the state has provided full payback of those, particularly for the Bay Restoration bonds. A significant amount of the transfer tax that was diverted during the Great Recession, though, was not fully repaid. There's also a transfer from the Waterway Improvement Fund, and a big piece, which I'll discuss a little bit more detail, is 167 million for the WMATA grant, which is mandated, was programmed to be used with general funds in this year, but is going to be funded with bond funds instead, in order essentially to free up that in the general fund forecast. Lastly, there's a transfer of about 187 million from the Fiscal Responsibility Fund. Basically, when the state's estimates of revenues are exceeded, so for fiscal 2025 that closed out, the revenues were higher than the estimate. A portion of that money goes to the rainy day fund, and another portion goes to the Fiscal Responsibility Fund, with those funds being earmarked to be used to support education, higher education, and K through 12 capital projects. But the Budget Reconciliation and Financing Act sweeps those over to the general fund, and there is no replacement for that. There's also no replacement for 25 million of transfer tax that was enacted last session. It takes 25 million out of land acquisition programs for fiscal 26 through fiscal 2029, and there is no replacement plan for those that was put in place. The exhibit on page 8 is kind of a summary. Well, how did the governor manage to do a significant amount of general fund transfers and other components that essentially put more pressure on the capital program? I'm going to move left to right on what's on page 8. And a big component of that is the Baltimore Therapeutic Treatment Center, which has been in the works now for several years. Roughly about $278 million of planned funding, and also a component of that is a deauthorization of funding that was authorized last year to start the project, has been moved. Part of it's being deauthorized, and another part is just simply being shifted out into the CIP. Another component of that is the Supreme Court building, which is also another significant project. The project schedule has been shifted out. And you can see some of these, the reason why is some of them they're just large. If you're trying to replace a significant amount of funding that was proposed to be funded, it puts a lot of pressure to replace that. And then you can see as you sweep down there and you sweep up, you can see the WMATA component. You can see the various MDE and DNR program shifts to bonds, as well as making room for legislative initiatives, because the governor does make room in his 5-year, or in the fiscal 27 plan anyway, for legislative initiatives for the legislature. A little more context on the Baltimore Therapeutic Treatment Center on page 9. I think many in this committee have heard testimony on this project now for several years. It is essentially sort of designed and ready to go, but the administration is putting that project on pause, essentially, again, to create some room. But it does offer an opportunity for the state to sort of reevaluate, the size and the scope of this project. It's over $2 billion, and that does not include what was proposed. It's no longer in the CIP, parking for people that would need to go, to that site, which is roughly another $200 million potentially. So it's a couple $2 billion for that project, and this may be the time to reevaluate that and where we are in compliance with the Duval agreement. On page 9 and into page 10, just a little highlight on bond premiums. So bond premiums, essentially, when the state is selling its bonds, if the coupon rate that the state issues those bonds is in excess of the true interest costs, the investors will pay the state a net present value calculation of the difference between those. And those bond premiums are in the annuity bond fund, and they support debt service, and they can also be used to support capital projects. Last year's budget included about $145 million of bond premiums spread out over a couple different bond sales. The bond sale in June did not materialize to its full extent that was estimated, and right now we're looking at roughly a shortfall of about $40 million, $5 million of which is being replaced directly in the budget, I believe, for a project at the University of Maryland Medical System, but another $35 million is still roughly unfunded. The governor's budget does include an amendment to a section in the Capitol bill that authorizes the use of bond premiums in the upcoming bond sale to fill that gap. But it will really depend on how much bond premiums are actually collected, given that the interest rates are continuing to rise and the spread between the true interest cost and the coupon rate is beginning to shrink. It's part of the reason why the bond premiums didn't fully materialize in the June 2025 sale. I'm going to turn it over to Emily on page 10, talk about strategic energy investment.
On page 10 and onto the chart on page 11, this shows the use of the Strategic Energy Investment Fund, or SEIF, for capital projects. The legislature authorized $32 million last session in SEIF funds for higher education projects. The fiscal 2027 capital budget is introduced, proposes $30 million in SEIF funds. That includes $17 million for higher education projects, $3.5 million for facility renewal under DGS. DGS estimates that the multi-year backlog of facility renewal projects includes about $120 million in projects that have some energy or carbon reduction impact. There's also $9.5 million in SEIF funds for the Comprehensive Flood Management Grant Program under the Department of the Environment. That would be for projects enhancing climate change resiliency. There's a provision in the BRFA that allows the SEIF to be used for the Comprehensive Flood Program. The BRFA, there's no BRFA provision for the higher education and facility renewal funds, as those are already an eligible use of SEIF funds. On the bottom of page 11, that begins the discussion of academic revenue bonds, or ARBs. The fiscal 2027 capital budget includes $50 million of ARBs. This complies with the SAC recommendation to increase annual ARB funding from $30 million to $50 million. The $20 million increase in fiscal 2027 includes $10 million to replace planned geobonds for the College Park Health and Human Sciences Building project, and also $10 million to accelerate funding for the Salisbury Electrical Substation project. As shown in the chart on page 12, this level is affordable within the USM debt limit policy of having a ratio of debt service to operating revenues and state appropriations below a 4% limit. And then I'll turn to school construction on page 14. You'll see there's $450 million in GO bonds included for public school construction. This meets the statutory goal. There's also $69 million in special funds for both the state and local shares of the Prince George's County Public-Private Partnership under Built to Learn. You'll see there's no funding in fiscal 27, as I mentioned earlier, for Built to Learn revenue bonds. And this is due to the delay in the planned issuance of the next Built to Learn bonds from fiscal 27 to fiscal 28. On page 15, you can see the proceeds from the 3 bond sales to date, totaling $1.1 billion. The Stadium Authority issues bonds for Built to Learn based on the project construction schedules, which accounts for the delay from fiscal 27 to now the expected issuance in fiscal 2028. The chart on page 16 shows the estimated funding available for projects based on various assumptions of interest rates for the next bond sale. So total Built to Learn project funding, depending on the interest rate, could range from a total of $1.65 billion to $1.78 billion. And I'll turn it back to Matt to talk about the transfer tax.
Okay, thanks, Emily. On page 17, we'd highlight what's going on with the transfer tax. The revenues that are being budgeted this year are actually up after a couple of years of declining revenues, slightly, as you see in the column of 2027, and this compares 25 and 26. I think the biggest component, though, is that the amount of underattainment is only about 12.6 million. And by that, I mean when the revenues were estimated in 2023, or for the 2025 budget. Again, those are estimates. If they over or under attain, that adjustment happens once that budget's closed out in the next fiscal year. So fiscal 27 essentially is going to account for any under or over attainment that takes place in fiscal 2025 relative to the estimate. And you can see in 25 and 26, the program was absorbing a significant amount of under attainment, roughly 80 million and 85 million respectively in the 2 prior years, which really had a bigger impact on what was distributed to the programs than the actual revenues declining slightly. And this chart just shows what goes to operating. A significant portion does go to support the Forest and Park Service and a few other areas in the Department of Natural Resources, and how much goes to the land preservation programs, or to the capital programs. And it does include an adjustment for the 25 million that, again, is not being replaced. And if you turn to page 18, this just gives you a breakdown of how that funding, including the GO bond, this just includes GO and special funds, all fund sources, and what is being funded in those in the various programs that are supported by the transfer tax. And again, you could see between the slightly higher revenue estimate and the smaller underattainment, there's significantly more available to the programs in fiscal 27 than there was in 25 or 26. I'm going to switch gears and just talk a little bit about transportation, I think, to close this out. First, we get back to a little bit more context on the WMATA grants. If you look on page 19, you'll see the history of how the state has funded the WMATA grants. And you can see in the red bars, particularly 25, 26, 27, that we've been using GO bond funds. That was not the plan in the prior year. The plan was to use general funds, but the state has ultimately been using GO bond funds the last several years, as we know that the state has been looking at in the midst of a structural deficit. The interesting point of this, though, is that the CIP continues to program the use of general funds in the next 4 years of the 5-year plan, roughly $668 million. It's going to be very difficult to continue to accommodate that with general funds, given the state's forecast. But at the same time, it'd be very difficult to also accommodate that in the GO bond program without continuing to defer some of the large projects that I talked about earlier in the presentation, particularly the Baltimore Therapeutic Treatment Center, without raising the debt limit. And then last but not least, just a sort of an update on the Federal Bureau of Investigation headquarters. Maryland was at one point selected by the General Services Administration to be the location. I believe they've pulled that back. The state did put $200 million into the budget in fiscal '24 and '25 combined for this project to do work at the Greenbelt Metro Station to accommodate that as part of sort of the sweetener on that project. Those funds have not been spent, obviously, because at this point, the project is not going to be located in Maryland. But there was legislation last year that essentially ensured that those funds would be available if and when the General Services Administration potentially changes their mind. Those funds would potentially be available to be used in the near term to solve some of your problems. But of course, this would then put, the way this legislation is crafted, it would essentially just continue to put a mandate on the state to provide those funds should the occurrence of being selected in Maryland actually take place. There's a number of appendices in the document. I don't think Emily and I are going to go through those unless there are any questions. And with that, we're here to take questions. Thank you.
Thank you, Ms. Haskell and Mr. Bennett, for always thorough analysis. I'll open it up to the subcommittee for any potential questions. All right, I don't see any. I'll ask one question. It appears that, the capital program is looking like a pressure valve for operating deficits. Is there a recommendation from DLS in the future, considering, what we've talked about with WMATA and with MSA and with BTTC on how we reroute that course?
Well, I think we'll be bringing you some recommendations on some of those projects. And when you hear the budget analysis, obviously, as you said, the capital program is being used as a bit of a pressure point. And how sustainable is that in the long run? How sustainable is it for the state to continue to use bond funds to support WMATA, for instance? In order to accommodate that, you're either stuck with moving projects that you had proposed to fund, or potentially, through the Spending Affordability Committee, looking at, raising the debt limit to accommodate those things. I think it's obviously, given the structural deficit, it's going to be difficult to accommodate these projects and these initiatives with general funds. And as you see in the product, there's very limited use of general funds in the budget. Prior to the 2023 session, the state had programmed a significant amount of general funds to support the capital program, and that's what resulted ultimately in raising the debt limit, as we saw that the structural deficit the state was facing wasn't going to be, that the general funds were going to be needed ultimately to try to shore that up. And so that's where we are at this point, where the general funds are kind of helping with the operating budget, but it is putting more and more pressure to accommodate those things in the GO portion of the program without making major restructuring to the 5-year plan.
Very good. It seems my question has spurred a question from Delegate Ivey, so go right ahead.
Thank you, Mr. Chair, and I appreciate the work that y'all have been doing on this over the years. I just had a point of clarity for those looking at this chart online. Page 14, you mentioned PGCPS, the P3 agreement that we have. It's unique out of the state of Maryland here. I believe that this is the one in purple, right? PAYGO SF Special Fund, correct?
That's correct.
All right, just wanted to make sure we were clear. Thank you, Mr. Chair.
Thank you guys so much. I believe we have one witness from DBM, and that's Christina Parati. Ms. Parati, are you here? Okay. Then that will end our hearing on the capital fiscal briefing, and we'll move into our additional briefings. I'm going to start with MHA, and we can have Ms. Martinez, Victoria Martinez, who is our analyst from DLS, offer us the DLS analysis.
Thank you, Mr. Chair and members of the committee. My name is Victoria Martinez, and I'll be presenting the capital budget analysis for the Maryland Hospital Association. The Maryland Hospital Association administers the private hospital grant program, in which private hospitals can apply for capital grants for programs that improve patient care. As shown on the cover page of the analysis, the capital budget provides $14 million in general obligation bonds, which is a $8.6 million decrease from fiscal 2026. Exhibit 1 on page 4 shows the 14 projects selected for fiscal 2027 grant funding, including the total cost of the project and the percentage that is state funded. And pages 5 through 7 have a summary of each of these projects. Moving on to the issue section, the first issue, beginning on page 7, provides an update on the status of projects through the program, funded through the program, which is summarized in Exhibit 2 on page 8. Most projects are in progress or complete, although 2 projects are delayed, one of which is planned to be deauthorized in the CIP due to no longer being able to move forward. The second issue begins on page 9 and discusses a decrease in proposed funding for the program in fiscal 2027, although funding remains higher than in prior years. Exhibit 4 on page 10 shows the total funds and number of projects funded in the past 10 years. There was a large increase in funding in fiscal 2026 following the passage of Chapter 790, which stated that the governor may include an annual appropriation of $20 million for the program. However, funding in fiscal 2027 provides only $14 million, which is under the amount suggested by Chapter 790 and also the pre-authorized amount of $20 million in the capital budget bill of 2025. And I'll conclude with our recommendations, which is to approve all general obligation bond authorizations and amendments to prior authorizations for the Maryland Hospital Association. And that concludes my presentation. I'm happy to take any questions.
Thank you, Ms. Martinez. Any questions? All right. We have, I believe, 2 or 3 witnesses for this hearing. Is Jane Krenke? And you guys can all come up to the panel. Also, is Jackie Stone here? And then Michael Finnegan. And we can go in that order. And if you could try to, we'll allow Ms. Krenke to have a little bit of leeway. If we could have the other witnesses keep their testimony to about 2 minutes, that would be appreciated.
Sure. Thank you so much, Chair Ruff, Vice Chair Chang, and members of the Capital Budget Subcommittee. My name is Jane Krenke. I'm here on behalf of the Maryland Hospital Association. We're here to testify in strong support for the 14 hospital projects that are included in the capital budget that were recommended for funding through the private hospital grant program. We'd like to thank our DLS analyst, Victoria Martinez, and our DBM analyst, Chizuko Godwin, for their guidance and support through the process. As noted in the DLS analysis, funding for the private hospital grant program is below the $20 million that was pre-authorized last year. The $14 million in funding included in the FY27 capital budget reflects a 30% cut to these projects. We're respectfully requesting that the committee restore funding back to that $20 million level. As you may know, MHA has been administering the private hospital grant program since it started back in the 90s, 1993, I believe. The process works in that hospitals submit applications to MHA. It's reviewed by a hospital bond review committee, which is made up of peers, a mix of trustees and hospital leaders. They review all the applications, score them, and then make funding recommendations based on the score. So along with our testimony, you'll find the letter that we submitted to the Secretary of the Department of Budget and Management with the review committee's recommendations. It includes a description for each of the 14 projects and the recommended funding level. We're asking that the committee, again, restore this funding back to the $20 million, which aligns with what the review committee recommended. These 14 projects will enhance healthcare in communities across the state. You'll hear from St. Agnes and Kennedy Krieger Institute in a minute about what these projects mean to them. So they might seem like small amounts of money, but for the communities where that money's going, it's a huge impact. And these projects are thoughtfully chosen, and they are all shovel-ready. That's part of our criteria for when they apply. We'd also like to encourage the committee to recommend increasing out-year funding to $20 million. That would align with the authorized funding level that's in statute and ensure the program can continue to meet the needs of hospitals. Every year, we receive way more applications and requests for funding than we can give out. And so we do our best to stick to the level that the legislature has established for us. The review committee is very, they try to stick with it, not go way above, ask for 40 million when we're only allocated for 20. So we are very thoughtful in these recommendations. An additional reason why this program is so important is that access to capital continues to be very challenging for hospitals. Under the global budget model, it makes it very challenging to put money aside for capital projects. So this is a vital program for our members. We appreciate the subcommittee's ongoing support for our program, and I'm happy to answer any questions you have. Thank you so much.
I think we'll take questions after the whole panel if there are any, and so Ms. Stone, you can go right ahead.
Thank you. Good afternoon, Mr. Chairman, Mr. Vice Chair, and members of the subcommittee. I am Dr. Jacqueline Stone, the Chief Clinical Officer at Kennedy Krieger Institute, where I've been a leader for the last 30+ years. Kennedy Krieger intends to open an outpatient healthcare hub in Prince George's County to expand access to neurodevelopmental and neurorehabilitation services. The healthcare hub will provide multidisciplinary care for children, youth, and young adults with complex medical, developmental, and behavioral needs. This integrated facility will include intensive rehabilitation, behavioral health, and trauma-informed mental health care in one location. Kennedy Krieger is the only provider in the region with the scope, expertise, and capacity to offer highly specialized neurodevelopmental care. No similar provider offers the same breadth of services in the Prince George's County, especially for medically complex children. By collaborating with community partners such as local schools, hospitals, primary care and specialty providers, early intervention programs, and insurance carriers, the hub aims to improve patient access and outcomes by enabling timely and comprehensive interventions, reducing wait times, and addressing provider shortages. Additionally, we aim to reduce care fragmentation by offering integration of multiple services under one roof and to serve residents regionally by extending beyond county borders through remote access. The healthcare hub is more than just a facility. It is a transformative model of care delivery that will fill a unique and critical gap in services. In closing, on behalf of Kennedy Krieger, I want to thank you and this subcommittee for its support of the Maryland Hospital Association Bond Bill program, which significantly impacts the health of Marylanders throughout our state. And I welcome any questions. Thank you.
Thank you, Dr. Stone. And Mr. Finnegan, you can go right ahead.
Thank you. Good afternoon, Mr. Chair and members of the committee. My name is Michael Finnegan, and I serve as Chief Operating Officer of Ascension St. Agnes Hospital. I'm grateful for the opportunity to provide testimony on the capital budget and to express our strong support for the restoration of the full $20 million appropriation for the Maryland Hospital Association's bond program. Ascension St. Agnes has served Southwest Baltimore metropolitan area for over a century, providing holistic care to a diverse population with a particular commitment to those most vulnerable and living in poverty. We deliver comprehensive healthcare services, including emergency care for approximately 80,000 patients per year. Long emergency department wait times are a widespread issue across Maryland, and this renovation directly tackles that imperative. We're not simply updating our facility, we are implementing a proven solution. Since August 2025, we have partnered with our emergency provider group, Vituity, to deploy their trademarked waterfall workflow, a system that enables rapid triage with providers and nurses working together to ensure efficient initial testing and patient disposition. The results speak for themselves. We have already reduced our time in department for discharged patients by 13%. However, we believe we have only begun to realize the potential of this new system of care. The current physical space limits our ability to fully implement this workflow. This renovation will create an infrastructure needed to literally flow patients through our waterfall process, allowing the right people to complete the right tasks at the right time and the right space. The total project cost is estimated at $4 million. We will cover the remaining costs, but this is a finite resource. Without full state funding, we face a difficult choice. either reduce the scope of this critical ER project or delay other important projects that our community also needs. We rely on external partners like the state to help us stretch our limited capital dollars. The impact on patient experience will be significant. Shorter wait times, more efficient care delivery, and better outcomes. This renovation represents a model for addressing Maryland's ED capacity challenges, and your full support will ensure we can maximize that impact. Thank you again for your consideration.
Thank you all. Are there any questions of this panel? Seeing none, I believe that concludes this hearing. Thank you all for coming and your attendance.
Thank you.
Thank you.
Next, we will move on to the Department of Information Technology. And I believe Secretary Savage is here. Come on up. Oh, first, we should have the analysis from Yashahara Rai from DLS. Thank you.
Thank you, Mr. Chair and committee members. I am Yashodhara Rai, and I'll be presenting the fiscal 27 capital budget analysis for the Department of Information Technology, or DOIT. The cover chart shows that DOIT's 5-year capital improvement program, CIP, includes 2 projects: Maryland First Responders Interoperable Radio System Team, or MD-FIRST, and Network Maryland Fiber Optimization. The fiscal 27 capital budget includes $16.3 million in general obligation bonds for MD-FIRST. Network Maryland Fiber Optimization Project is an out-year project and does not have funding in fiscal 27. There are 2 key observations highlighted on page 2. The first bullet notes that a new 10-year sole source maintenance contract with Motorola was approved by the Board of Public Works on November 19, 2025. This new contract covers only the maintenance component of MD-FIRST infrastructure with 4 system upgrades. In the last session, DOIT explained that a no-cost extension may be exercised to complete work for projects that receive funding in fiscal 24 and 25. DOIT should comment on the status of the no-cost extension of the original Motorola contract if this no-cost extension includes work for projects that received funding in fiscal 26, and if new solicitations will be required for all projects receiving funding in fiscal 27 and the out years. The second bullet notes that 1 new subprogram under MD-FIRST is added with fiscal 27 budget. This subprogram was not in the original capital master plan and will replace and upgrade the current Motorola GTR 8000 base station radio with the D-series base station radio because Motorola is ending support of the current equipment effective December 31st, 2032. DOIT should comment on a revised capital master plan and its plans to identify additional deficiencies, their solutions, and estimated costs. On page 4, Exhibit 1 shows the 5 phases in which the original infrastructure build of MD-FIRST was completed. The latest was Phase 5 in April 2023. The bottom of page 4 highlights that the T1 to Ethernet conversion for phases 1 through 4 was completed in September 2025. Final transition of all project data and documentation is expected to be completed by March of 2026. DOIT originally planned 4 subprograms to address deficiencies related to interoperability, poor coverage, and maintenance of incompatible radio systems. This is shown in Exhibit 2 on page 6. And as mentioned earlier, beginning fiscal 27, 1 more subprogram, which is the base station radio replacement, has been added and is shown in the orange bars. Of the $16.3 million in fiscal 27, $7.6 million is for radio towers, $1.3 million for fiber optics and control sites each, about $500,000 for in-building amplifiers, and $5.6 million for base station radio. Even though a new subprogram has been added, the total fiscal 27 budget of $16.3 million is consistent with last year's CIP. This has been achieved through the reduction of funding for fiber optics and in-building amplifier subprograms and using these reduced funds for the new subprogram. Exhibit 3 on page 7 provides an update on planned radio sites from fiscal 24 to 29. This subprogram is programmed to receive $7.6 million for 3 projects in fiscal '27 and a total of $8.6 million from fiscal '28 through '29. Exhibit 4 on page 9 provides an update on the fiber optic expansion subprogram. This subprogram receives $1.3 million in fiscal '27, which is $5 million less than last year's CIP. From fiscal '28 through 2031, this subprogram is estimated to receive a total of $4.9 million, which is $6.1 million lower than last year's CIP. These reduced funding will instead be used for the new base station radio subprogram. The fiscal '27 funding will support 2 fiber optics projects, and a total of five fiber optics projects is planned for the out years. The third subprogram begins at the bottom of page 9. This receives $535,000 in fiscal '27 for 2 in-building antenna installations. This is $590,000 lower than last year's CIP to support the new subprogram. In fiscal '28 and '29, this subprogram will receive a total of $1 million, which is $2.6 million lower than last year's CIP. DoIT should provide a status update on the projects that have received prior authorizations. The fourth subprogram is on page 10. The control sites subprogram receives $1.3 million in fiscal '27 for 1 control site. From fiscal '28 through 2030, this is programmed to receive a total of $7 million. The top of page 10 discusses the new base station radio replacement. While the end of support for the current equipment ends beginning calendar 2033, DoIT states that Motorola has agreed to extend support for the current base station radios through December 31st of 2039. However, there is no performance guarantee for the extended support. There's a total of 1,064 GTR 8000 base station radios at about 145 radio frequency sites statewide, and DoIT plans to replace 20% of this inventory by fiscal 2030 and the remaining 80% by fiscal 2040. The total estimated project cost is $76.4 million. In fiscal '27, this subprogram receives $5.6 million for 13 radio frequency sites in 4 counties. A total of $11.9 million is programmed from fiscal '28 through '31. The bottom of page 11 discusses the out-year fiber optimization project. This project is expected to start in fiscal 2030, and the estimated cost for this project is approximately $3.2 million in fiscal 2030 and $1.4 million in fiscal 2031. And the total estimated project cost is $10.8 million. Appendix 1 on page 12 shows the operating budget impact of MD First. Fiscal '27 allowance includes $19.9 million in operating costs, including 8 regular positions. Of these, $18.2 million, or 87.9%, is for contracts. At the bottom of page 2 is DLS's recommendation to approve all $16.3 million in GEO bonds authorization. This is the end of my presentation, and I'm happy to answer any questions.
Thank you, Ms. Rai. Are there any questions of the subcommittee for Ms. Rai? Okay, seeing none, Madam Secretary, you can go right ahead.
Okay. Good afternoon, Mr. Chair and members of the committee. My name is Katie Savage, and I'm the Secretary of the Department of Information Technology. I'm joined today by Eric Bathurst, who is our Chief Technology Officer in the Office of Infrastructure. I thank you for the opportunity to provide testimony today, and I also want to thank Yasho for her incredible support and services to our department. For fiscal '27, DoIT has 1 capital project for the committee's consideration, which is Maryland First Coverage Improvement Program. Maryland First is the state's primary public safety communication system used by over 130,000 first responders across over 130 agencies to support daily operations and emergency response. Our FY '27 request of $16.2 million will help improve radio coverage by adding 3 new sites in Bowie, New Germany State Park, and Newmarket, and expand bidirectional amplifiers to strengthen signal in locations like schools and government buildings, and add additional fiber connections to make the system more resilient. This investment is focused on reducing coverage gaps and ensuring the system remains dependable for first responders. We respectfully ask for approval of DeWitt's FY27 capital budget request and encourage the committee to refer to DeWitt's written testimony for additional detail. My staff and I are happy to answer any questions. Thank you.
Thank you. Are there any questions of the subcommittee? Seeing none, thank you all, and that will conclude that hearing. Next, we will have Secretary Addix and Mr. Tilburg arm wrestle to determine who goes next. No, we'll call Department of Agriculture and start with our DLS analysis from Mr. Gray.
Thank you, Mr. Chair. I will now present the Maryland Department of Agriculture's fiscal 2027 budget analysis, PAYGO budget analysis. Jump right to page 2, get right into the recommended actions, which are to concur with the governor's allowance for PAYGO and for the GO bond recommended actions to approve the authorization for the Maryland Agricultural Cost Share Program and the proposed deauthorization for the Salisbury Animal Health Laboratory Replacement Project. In terms of updates on page 3, there's 2 components there, the Salisbury Animal Health Laboratory deauthorization. So they've completed the project, and they're going to deauthorize $622,224 just because the money is no longer necessary for that purpose. And in terms of the Maryland Food Center Authority's wholesale produce market, the fiscal 2023 budget included $10 million in the dedicated purpose account for that particular project. There was $10 million from the state, and then there was a proposal for $2 million from Howard County, $1 million of which has been received and $1 million to be still received. On December, in terms of the overall cost for the project, was estimated internally by the administration around $30 million. So there's a bit of a surprise. On December 3rd, 2025, the Food Center Authority did receive their bids. The 2 responsive bids were on the order of $50 million, obviously $20 million more than the overall cost kind of originally considered. As a result, the Maryland Food Center Authority's Board of Directors, which includes a lot of ex officio state employees as well, state secretaries, met to kind of determine what are the next steps, what's going to go forward. The idea is to look at or use the available funding for a reduced project scope at this time, and to look at the possibility of working with the Maryland Economic Development Corporation on a potential debt issuance of some kind in order to finance the project. And that will kind of be seen over the next couple of years. On page 5, Exhibit 1 reflects the big picture for the authorization and appropriation for fiscal 2027. So you see the $38.7 million in special funds, $26 million or so for the transfer tax special funds that go to the Maryland Agricultural Land Preservation Program, and then $12 million in local participation funding. And you also see $8 million for the Maryland Agricultural Cost Share Program, which receives funding in 2027, which it did not receive in fiscal 2026. On page 6, just kind of describe a little bit about the Maryland Agricultural Land Preservation Program. So it preserves productive agricultural land and woodland to reduce and limit the extent of urban development and protects agricultural land and woodland as open space. One of the things to consider here is that the transfer tax, as Mr. Klein described earlier, has rebounded, which is really nice. We're seeing a lower underattainment from fiscal 2025, which means that they were taking less away from fiscal 2027, and the revenue estimate's gone up. So $20.1 million increase in Maryland Agricultural Land Preservation Program's funding between fiscal 2026 and 2027 due to that increase in transfer tax funding. Per the Budget Reconciliation and Financing Act of 2025, you do have that $25 million overall transfer of funding to the general fund. So that was $15 million from the Maryland Agricultural Land Preservation Program in 2026, and $11.7 million is their share for fiscal 2027. So that does reduce, obviously, the overall amount of funding for their purposes. And in consideration of that, the Maryland Agricultural Land Preservation Program has constrained actually combined the easement cycles that it has been doing. So instead of using 1-year money for 1-year ag land preservation purposes, they're doing 2 years of easements with 1 year of funding because the money has come down. And they're going to look again at whether that needs to continue in probably April 2026 or so to see if that's still necessary. Then on page 7 is the Maryland Agricultural Cost Share Program. $8 million is authorized for fiscal 2027. Once again, that's $8 million more than last year because no money was authorized at that point. The fiscal 2026 does signal the end of Chapter 120 of 2021's increase to 100% funding for particular projects. These are the natural filters projects that control agriculture-related non-point source water pollution. So that funding increase to 100% instead of the 87.5% will end in this year, and MDA does expect to see some people getting interested in that kind of funding towards the end of the year, kind of that last rush to kind of see if we can kind of get into it. But overall, it's not necessarily the bump that we were hoping to see from that particular program. Unless there are any questions, that concludes the presentation.
Thank you, Mr. Gray. Any questions from the subcommittee? All right, Secretary Addix, you may go ahead.
Thank you very much, Chair Ruff, Vice Chair Chang, members of the committee. Great to join you today to address our capital budget. First, want to thank Mr. Gray for his always thoughtful analysis. And I did want to stress that during these pretty tough economic times, the budget you have before you continues to reflect MDA's mission to provide leadership and support our agriculture and rural communities. Agriculture is, as you know, Maryland's #1 commercial industry. The budget before you also reflects the core values of the Moore-Miller administration to make Maryland one of the greenest states in the country by preserving agricultural land that provides fresh local food for all Marylanders, while also continuing agricultural programs that improve soil health and restore our treasured Chesapeake Bay. As Mr. Gray noted in his analysis, both the department's capital programs are receiving funding this year. The Maryland Ag Land Preservation Foundation, otherwise known as MALF, and the Maryland Ag Cost Share Program, also known as MAX. As you recall, last year, MAX did not receive an appropriation in the capital budget because it was carrying over funding from prior fiscal years. Over the past year, the program has wound down those funds, and we are teed up to again need this appropriation if we're going to continue our cost share programs. These programs are critical. They're key. They're key as part of our equation to meet our Bay goals, and farmers have responded quite well to them over the years. MALF, on to MALF, is a highly successful, nationally recognized program that preserves productive farmland and woodland to limit urban development, and it protects land in perpetuity for agricultural purposes. Last year in the BRFA, a $25 million cut was enacted for 4 years for a total of $100 million from program open space funding. For FY26, MALF's share of that cut was $15 million. FY27, MALF's portion is $11.7 million. We understand these are tough fiscal times. We're asking that program open space and MALF receive no further cuts. Finally, I'd like to take the opportunity, since it was mentioned by Mr. Gray, there is a new director, a new executive director of the Maryland Food Center Authority, Katie Zenk. She's here today if you have any questions. Katie joined the Food Center Authority after a career at USDA. She was a senior advisor to the secretary and deputy undersecretary for marketing and regulatory programs. While she has a keen eye for operations, what's great about Katie is she's got a true vision for how this Maryland Food Center Authority, a secret hidden asset within Maryland state government, how MFCA can play a much greater role in Maryland's food system going forward. With that, I just wanted to end with, I really appreciate your critical investments in the capital budget of both of our core programs. I appreciate your partnership with the legislature and working collaboratively with you to make sure that we're making best use of our funds. And I neglected to introduce Heather Barthel, our Assistant Secretary for Administration, and we're both here happy to answer any questions.
Thank you, Mr. Secretary. We obviously appreciate you as well and your importance of your agency for our state's economy. Any questions from the subcommittee? Yes. All right. Delegate Metzger.
Thank you, Mr. Chair. Thank you, Mr. Secretary. I failed to either see it or is there any money in the budget for the midges? You know, we have a real problem. The bay is our treasure. And my boat owners and boat yacht marinas can hardly go into their boats anymore with the midges. Where are we at with that?
I hope you asked that question again during our operational
I just wanted to
hearing.
make sure I
Yes.
didn't jump the boat.
Yes, no, you don't want to miss that. And just for the committee's clarification, midges are quite a problem in Baltimore County and moving up into Hartford County, not to be confused with black flies, which are in western Maryland. The midges are a non-biting but incredibly nuisance insect. And I just saw some numbers from Baltimore County. They received thousands of reports last summer from constituents because it's not just like a mosquito that you see in here and there. These are swarms. They cover houses. People describe their windows being blacked out by these midges. We do have treatments available, and we're happy to talk about them anytime.
No problem. I just want to make sure it's there.
We'll offer tours in May of Middle River.
All right. Seeing no other questions, thank you, Mr. Secretary.
Thank you.
And that will end your hearing on that does not end the hearing. If you wouldn't mind hanging around, Mr. Secretary, for the testimony of our witnesses. We have a couple of witnesses that are all favorable in support of this budget. Is Ann Jones here? And Owen Bailey? Okay, you can, what's your name, my friend? Carol? Got it. I already have you on my list. And Mr. Galley? So we can, and Anna Griffith. Ms. Griffith? All right. Ms. Jones, you can go right ahead.
Thank you so much. And I know you just as soon if we just got out of here and said we agree because it's always a long day. My name is Ann Jones, and I've worked with land preservation and a number of local land trusts for about 25, 30 years now. This funding, I very much appreciate the fact that the governor's budget includes funding for the MALF program, the full funding. It is essential. When I work with farmers and sit across the table from people who make the decision to permanently preserve their farm, this is not a decision lightly made. And when they are ready to act, when they have sat with their kids and they've sat with their grandkids and they've sat with their financial advisors and they're ready to go, if that money isn't there, if we can't say that there's sort of a constant stream coming in, it's a huge problem. It hurts both the credibility of the program and the people's desire to preserve it. So appreciate what you're doing here. After we preserve it, we also go ahead and a lot of times work with them to put other conservation practices on it. So that is why we also support the MAX program and appreciate your help. Thank you.
Thank you. Ms. Bean?
Thank you.
Go right ahead.
Chair Ruff and members of the committee, I'm Carol Bean with the Eastern Shore Land Conservancy. Here requesting support for the governor's budget for Maryland Department of Agriculture. Eastern Shore Land Conservancy is a nonprofit dedicated to conserving, stewarding, and advocating for the rural landscape of the Eastern Shore. We work with private landowners, local governments, and state partners to permanently protect farmland, wetlands, forests, and other natural resources that define our special region. The programs administered by the Maryland Department of Agriculture are really some of the most effective tools that are out there to permanently protect farmland, to improve soil health and farm resilience, to reduce nutrient runoff, which support Chesapeake Bay restoration goals, and importantly, to keep working lands economically viable for the next generation of farmers. For communities on the Eastern Shore, these programs, to sort of echo what Ms. Jones said, this sort of stability and predictability of them has been one of their strengths. And farmers need to know that that funding will be available. Local other land organizations, local governments, and state leaders kind of rely on that to do sort of appropriate planning for preservation goals. So we respectfully encourage you to adopt the governor's budget and support MDA.
Thank you for your testimony, Ms. Bean. Mr. Galley.
Thank you, Mr. Chairman, members of the committee. My name is Eric Galley, and I'm here today on behalf of the Maryland League of Conservation Voters in support of the proposed budget for agriculture. The League of Conservation Voters wanted to remind you all that land preservation is a very important part of our bay restoration and climate change prevention goals. It's a very key element, and the land that we lose because we're not doing it in any given time is land that is usually lost for good. We understand that taking the $25 million a year for 4 years was probably a necessary thing with the budget in the condition that it is, but we would ask you, please, let's not make this a regular habit, and let's get back to the full funding as soon as we possibly can. Thank you very much for your consideration and your time.
Thank you for your testimony, and Ms. Griffith.
Good afternoon, Mr. Chair, members of the committee. My name is Anna Mudd Griffith, and I'm the Senior Policy Director for Potomac Conservancy. We are the region's leading clean water advocate, and we have 42,000 members located in the Potomac watershed, most of them living here in Maryland. Today, I'm here on behalf of Forever Maryland. We are a coalition of nearly 30 land trusts and land conservation organizations located throughout the state of Maryland in every region of the state. We're here today to offer our strong support of this year's capital budget for the Department of Agriculture. In particular, we want to strongly support full funding for Maryland's Agricultural Land Preservation Foundation, Maryland's Agricultural Cost Share Program, Marbitco, and the Conservation Reserve Enhancement Program. We believe these programs are essential to achieve the state's broader land conservation, water quality, and climate goals. And for these reasons, we urge the committee to support full funding for this year's capital budget. Thank you.
Thank you to each of you for your testimony. I see one question. And Delegate Watson, go right ahead.
Not really a question, but I'll make it a question if you want me to. I just wanted to say thank you to all of you for the work that you do, environmental work, land preservation. We see you all the time, everywhere, and you are advocating for all of the people in Maryland, so thank you.
Thank you. Ditto. Ditto, for sure. Question here?
No, it's just a, isn't that so?
Very good. Well, certainly we all, I think, speak on behalf of the whole subcommittee, appreciate all your work on behalf of our state, and thank you so much for your testimony today. That will conclude the hearing on the Department of Agriculture, and we will go to our final briefing with aid to the University of Maryland Medical System. Start with our DLS analysis from Ms. Naomi Komuro.
Good afternoon. My name is Naomi Komuro. I'm the budget analyst with DLS, presenting the fiscal 27 budget for the University of Maryland Medical System. The fiscal 27 capital request includes $226.4 million for 3 projects under UMS, which are the University of Maryland Shore Regional Health's new hospital in Easton, the ongoing renovation of the Shock Trauma Center, and the Comprehensive Cancer Center, also located on the University of Maryland Medical Campus. Of the total request for fiscal 27, $30 million are made up in GO bonds, and the remaining is non-budgeted funding from the University of Maryland Medical System. On the top of page 2, we've briefly summarized the Greenbaum Cancer Center project. This expands capacity for cancer care by building a 9-story addition to the existing hospital. Funding that was included in fiscal 27 included a $5 million deficiency appropriation that went unused, which is the amount that is included in the fiscal 27 request. Pages 2 and 3 summarize the new hospital facility in Easton. The fiscal 27 request includes $208.7 million for planning, construction, and equipment. Pages 4 and 5 summarize the project at Shock Trauma, including the ongoing progress of the different components of the renovation. And the fiscal 27 request includes $12.8 million for construction and equipment. DLS recommends approving all general obligation bond authorizations for the University of Maryland Medical System, and that concludes my presentation. Take any questions.
All right, thank you so much. Are there any questions of the subcommittee? All right, seeing none, I would call Mr. Brian Sturm and Mr. Will Tilburg. Is Mr. Sturm here or no? Okay, Mr. Tilburg. Mr. Cazell, you can certainly come on up. We welcome to our subcommittee. Thank you so much for your attendance. And Mr. Tilburg, you were saved from the arm wrestling match, so.
He's bigger than me, so thank you for that.
I don't know where my money would have been. Thank you. You can go right ahead.
All right. Good afternoon, Mr. Chair, members of the Capital Budget Subcommittee. Will Tilburg on behalf of the University of Maryland Medical System, here today, again, with my colleague Ken Cazell, president of Shore Regional Health, to testify in support of two critical capital projects for the medical system, for the communities that we serve, and for the residents of Maryland. Specifically, one, construction of the new Regional Medical Center in Easton, and two, renovation and upgrades to several parts of the component parts of the Shock Trauma Center. I'd like to start by thanking Governor Moore, Department of Budget and Management, this subcommittee, and the General Assembly for all the support and collaboration you've shown to the system. The state and UMS have a long-standing partnership, and over the past 40 years, this partnership has transformed healthcare delivery within the state, particularly for the most vulnerable populations. I'd also like to thank our DLS analyst, Naomi Kimura, who prepared the budget analysis, and our DBM analyst, Paul Rader. They're both incredibly hardworking public servants and have been very responsive to our team and to me personally throughout the capital budget process. Turning first to the shock trauma renewal phase 3, this project is essential to modernizing the facility and ensuring that we remain prepared to treat the most critically injured and ill patients statewide. Shock trauma treats more than 6,000 individuals each year, and they come from all jurisdictions within the state of Maryland. In FY27, there's $5 million in capital allocation to continue to help us make vital upgrades to equipment and clinical spaces so we can meet the growing demands of our state and its population. In particular, phase 3 directly strengthens life-saving operations, including the trauma resuscitation unit, with state-of-the-art capabilities to ensure rapid response and timely access to care during the most vulnerable moments in a patient's life. We're also restoring and upgrading our hyperbaric medicine unit, Maryland's designated referral center, which provides over 5,000 hours of critical and ambulatory care each year for patients suffering from life-threatening conditions, such as carbon monoxide poisoning. And finally, the planned expansion of the trauma acute care unit from 10 to 16 beds, which will continue to allow us to provide more care for patients while improving flow and overall patient experience. We want to thank you again for your continued support. And with these dollars already, we've strengthened infrastructure, including improving air handling systems, emergency power, fire alarms, medical gas systems, and just last month, a new blood bank was opened, an expanded blood bank, which is now adjacent to the trauma resuscitation unit itself, as opposed to what was equivalent to a 2-block walk. So this is truly life-saving changes that are the result of this program. So with that, I'll turn it over to my colleague, Ken Cazell, to provide an update on the Shore Regional Project.
Thank you, Mr. Tilburg. Before you go, is Mr. Sprinkle here? Okay, you can come on up, sir. And Mr. President Cazell, you can go right ahead.
Thank you. Thank you, Mr. Chair. Thank you, members of the Budget Subcommittee. On behalf of grateful Midshore community covering 5 counties and nearly 2,000 square miles of Maryland with 175,000 residents, we thank you for your continued support for our Regional Medical Center construction project. While over 600 rural hospitals are struggling to survive across the United States, I'm pleased to share that with the collaborative agencies like the MHCC and the HSCRC and the state's unwavering support, we are making meaningful progress towards improving access to care throughout our region as we focus on improving the health of the community we serve. The construction of our Regional Medical Center is beginning to take shape, with foundations set and floors being added vertically each month. Likewise, daily drilling of wells for our geothermal temperature control system is in process, with more than half of the 1,728 wells well underway. Road work on Route 50 is also underway, designed to create safe access for entering and exiting our new campus. As construction for the Regional Medical Center advances, we are also working diligently to meet our $100 million private fundraising goal. By securing over $70 million thus far, we are well on our way to achieving that target. The University of Maryland Shore Regional Medical Center project is a perfect example of public and private partnerships working together to ensure equitable access to health care across our state. From the residents living in Maryland's 5-county rural Midshore region, we thank you for your unwavering financial commitment and for your steadfast support of this transformational project.
Thank you, Mr. President. I have to agree with you, and I'm looking forward to you guys finalizing that project. I represented a gentleman down in Princess Anne a couple years back who was slammed on his face by the police and had his jaw traumatically broken, had to have an ambulance ride all the way to Baltimore. And you can imagine how excruciating that would be. So definitely grateful for y'all's work and making sure you're providing trauma-informed and trauma care on the shore. So thank you for making time to come over and present this testimony today. Mr. Sprinkle.
Again, my name is George Sprinkle. I'm the Senior Vice President and Chief Financial Officer for the University of Maryland Medical Center, and I defer to my colleagues.
Just here to
answer any questions. Yeah.
Very good. Well, thank you guys for your testimony. I'm sure I knew to look to our good chair of the caucus for a wonderful question for our folks. So if you wouldn't mind, Delegate Shetty, please go right ahead.
Thank you, Mr. Chairman. Really exciting to be here and call you that. Thank you so much for coming to testify from all corners of the state, and thank you for the work that you all are doing. We really have a lot to be proud of in our state from the University of Maryland medical system in general, especially our trauma work. So huge shout out and gratitude for that. Want to take a moment to share that just this morning I read an article about some groundbreaking clinical trial research happening at and specifically a case profile of a young woman with glioblastoma who, I mean, this is like an incredibly fatal brain cancer, very aggressive, and 4 years out, she's showing no signs of cancer return because of clinical trial research that happened and a clinical trial she participated in at Really exciting work. So I want to ask a question kind of on behalf of Montgomery County and our biotech hub. We are so proud that we have a lot of great research happening in our state, and I just want to ask if you all aren't capable to respond here today, that would be fine if you want to follow up, but just share with us a little bit of some of the challenges that you're facing in pursuing partnerships and clinical trials, because we want to make sure that every single cure that is being researched here in our state, we're able to claim credit because the clinical trial work is happening here in our amazing research institutions.
Sure. Thank you for the question, and I'm probably not the best person to answer that question, so we're going to make sure we get back to you on a more detailed question. I can tell you we have over 1,000 clinical trials going currently today. More than 25% of those are related to some very unique oncologic opportunities that we have as well. We are working with subject matter experts externally to improve on our process, but we will get you some more detailed feedback on that.
I will take the privilege of having the last question. Could you guys, Mr. Tilburg, anyone, give us just a little bit more color on the expansion of the Greenbaum Cancer Center, just for the members of the subcommittee and for our general public? And I'll just note that Delegate Shetty and I had an opportunity to come visit, I guess it was 2 months ago or so, and we were just floored. Am I right about that? Yeah, time. Who knows how long? It wasn't that long ago. But if you wouldn't mind just giving us a little bit more detail so that the members of the subcommittee can also hear the plans and how these capital dollars will certainly be pushing us forward in our cancer treatment in the state of Maryland.
We have a subject matter expert right here. We can bring someone up to address that.
I'm all about experts.
So good afternoon. My name's Cheryl Koch. I'm the Vice President of Operations for the University of Maryland Medical Center, and can talk about the construction and our progress, if that's kind of the focus that you wanted me to have. Absolutely. So thank you for the opportunity to share. So the Center for Advanced Medicine and the Greenbaum Cancer Center is really progressing well. We plan to open and see our first patient mid-September, and that's kind of where we're targeting. We hope to have our substantial completion at the end of April. After that point, we will start loading all of our, equipment, furniture, and preparing for first patients. So the building is really progressing very nicely, and we will, we don't see any barriers to opening kind of in that mid-September date.
All right, thank you so very much. And unless there are any other questions of the subcommittee, I'll take a personal privilege to just say thank you to everyone for this first subcommittee hearing. And I want to offer, since I'm not going to do it on the floor, thanks to my Chief of Staff, Shivani Sid, who is here providing us technical support. So thank you, Shivani. Recent University of Maryland grad. And with that, if there's no other business, we are adjourned.